Do you want to increase brand awareness, attract new patients immediately and consistently, and become the go-to practice in your community? Then learn how to do ground marketing. That's what I'm going to be teaching you in this series. Let's dive in. All right, we're going to be discussing identifying your target audience. Now, this is huge. How to pinpoint and approach your ideal patients through ground marketing. So right now, if you're thinking, man, I hear this all the time, I need to find my target audience, I need to know my ideal patients. Maybe sometimes you're thinking like, I just want any patient, but no, you got to get specific here, niche down. And you do have an ideal patient in your mind, right? Maybe you're an existing practice and your favorite patients, those are your ideal patients. If you don't have a practice yet and you're in the opening startup phase, who you've worked with in the past as an associate and your favorite patients, whoever they were, those are your ideal patients, right? Obviously, it's going to evolve within time. You're going to get more niche down and more specific, which is going to be perfect because you're going to be able to target that audience. So why targeting matters in ground marketing? So ground marketing is not about reaching the most people. It's about reaching the right people. Without precise targeting, efforts are wasted on audiences who are unlikely to convert into loyal patients. So identifying your ideal patients ensures that your marketing is efficient, high converting, and relationship driven. That's what's going to be most important, right? You want it to be efficient. Obviously, you want it to convert as high as possible, but relationship driven. These offers or these other things, they can be easily broken, right? You can cut ties quickly. But once that relationship thickens and thickens more, it's harder to cut because it's a relationship. And that's what you want. You want these ideal patients, all of them, to be relationship driven. Unlike digital marketing, where you can segment audiences with online analytics, ground marketing relies on behavioral, demographic, and psychological factors to pinpoint ideal patient groups. And in the previous episode, we discussed the psychology behind ground marketing. Now, the science behind patient behavior and decision making. If we understand how people make healthcare decisions, it's going to help us tailor our approach in ground marketing. So I want to give you some key psychological factors that drive patient choices. And these are things you need to keep in mind whenever you're out ground marketing or just in general, whenever you're doing any type of marketing, okay? It's 4 things. And number 1, this is a huge one, proximity and convenience. People prefer healthcare providers within a 10 to 15 minute radius from home or work. So a solution for this is you want to focus on high foot traffic areas near your practice. Grocery stores, schools, gyms, coffee shops, anything in that area, in that radius, you want to focus on. And there's a module in the ground marketing course. It's under the existing patient analysis, the EPA module or the EPA unit. We discuss this in depth. We dive a lot deeper on the exact radius you should be looking at for your practice. That's number 1, proximity and convenience. 2 is trust and social proof. So patients choose providers recommended by friends, family, or familiar community figures, right? The solution for this would be leverage word of mouth referrals and local partnerships to build credibility. So your favorite patients right now, the ones who talk you up, make sure they are consistently talking you up, but you want to turn them into ambassadors who can turn other potential patients into ambassadors. You want to keep this going. That's going to be social proof. And you want to build trust as well. That builds a lot of trust. As we know, that's the strongest form of marketing, which is referrals, word of mouth. So that's what you want to do. You want to leverage word of mouth referrals and local partnerships to build your credibility. That's 2, trust and social proof. 3 is immediate need versus preventative mindset. Now, some patients seek urgent solutions. Maybe they have tooth pain, emergencies, right? Things like that. Then others prioritize long-term dental health. So Invisalign, cosmetic work, etc. Your solution for this is segment patients based on need and customize your approach accordingly. If you're going for emergency patients, that's what we're going to start targeting. Emergency locations, clinics, urgent cares, specific locations. If you're looking for long-term preventative, think of cosmetic, right? Or full mouth reconstruction or something else. Invisalign, implants. That's where you want to start targeting. Start thinking of where that demographic probably would be. That coupled with trust and social proof and then proximity and convenience. Now we're targeting, right? We're niching down. And finally is financial concerns and insurance acceptance. So many patients choose a practice based on insurance coverage or affordability. This is not new to you. You know this. You get a call maybe a couple times a day saying, does my insurance cover this? Many patients choose a practice based on that. So the solution is highlight flexible payment options and insurance acceptance in your marketing. And we're going to dive deeper into this. And in the ground marketing course, there's a whole section on this, on how to verbalize or enhance your vocabulary so you know how to respond when people ask questions like, do you accept my insurance? Or how much does this cost? And so forth. So identify which psychological driver fits each audience and tailor your messaging accordingly. Okay. So little do you know, right now, your marketing message is tailored to a specific target audience. Is it the target audience that you want? Based on these 4 things: number 1, remember proximity and convenience; 2, trust and social proof; 3, immediate need versus preventative mindset; and 4, financial concerns and insurance acceptance. Based on those 4 things, who do you think your marketing messaging is targeting right now? So we're going to niche down. If it's the right people, perfect. We're going to continue to do that. If it's not, we need to adjust and make sure you want to niche down to your ideal patients, who you want to continue to see forever if you could. So now that we got that down, number 1, the science behind patient behavior and decision making. We understand how the patients are going to be making decisions. Now we want to define your ideal patient persona. So a patient persona is detailed profile of your target patient. You want to consider the demographics, behaviors, and pain points. So the steps to create an ideal patient persona. And here's where you probably want to take out your pen and paper, write this down, right? And start analyzing and start defining your ideal patient persona. So step 1, analyze your current patient base. Who are your most loyal and high value patients? Write that down. What age group, income level, and insurance plans do they have? Write that down. Group them. What common concerns bring them to your practice? Write that down. Okay. That's going to be huge. This is probably the biggest thing ever, because let's just say you have a lot of patients, right? And you're writing it down. You're like, your most loyal and high value patients is, let's say, Bob and Barbara. I love them. What age group are they? Oh, they're one's in the 30s, one's in their 50s. Okay. Income level. Oh, I see the income level is common. It's in the 100K to 250K. And they do have insurance too. They have PPOs. Okay, cool. Awesome. What common concerns bring them to your practice? Well, they both had initially, pain, or maybe they moved and then they wanted to see a new dentist or something, or they just had concerns or they wanted cosmetic work done. Now you're starting to niche down. Okay, where do they work? What income level? Where is their HOA, or where do they live, and what type of apartments? At the same time, wherever their hobbies are, what are they doing? Things like that, right? You're starting to live around their life. That's how you're analyzing your current patient base. Once you live around their life, they go to these grocery stores, they go here, they go here. Now we're starting to niche down. Let's focus on those locations to ground market too. So step 1, most important step, analyze your current patient base. Step 2, you want to research your local demographics. You can use your US Census data, city planning sites, or my favorite is local Facebook groups to gather insights. Just go to the Facebook group in your community. There's probably 5 or more. And then they even niche down on that. There's mom groups, there's athletic ones, there's ones who love recipes and stuff like that. And just in your community, niche down on that and be a part of those Facebook groups. And you're able to gain some insights on that. What are people talking about? Even if you just type in the search bar, dentist, you're able to gain a lot of insight on that. What's their concerns? What are they looking for? And things like that. And then you want to identify major age groups, household incomes, education levels, and common employment types. Always do that. Every single one of your patients, you should be able to know where they work at, what type of obviously insurance they provide, but at the same time, what I recommend, and in the course, we recommend this all the time, and we teach you, we give you the scripts on exactly what you should say and how to do this so that you can get into these patients who, let's just say, oh my God, you work at the Amazon fulfillment center. It's a corporation of 10,000 employees or 100 employees, and you would love to have them as your patients because their insurance is great. Yeah, we give you the script on how to ask that patient who's already a patient of yours, how you can dive deeper into their place of employment, who do you need to contact, things like that, in order to go inside of the corporation and become one of their main providers. So you definitely want to be asking these questions to all your existing patients already, but at the same time, this is something you want to sit down and start identifying yourself. The age groups, household incomes of your ideal patients, the education levels, common employment types, things like that. So that's step 2, research local demographics. And the way you can do that is by going to Facebook groups, but US Census data and city planning sites are good too. Facebook groups, you're able to get a little bit more insight casual conversations, which is what's on their mind at that time, and identify a lot of the insights that you're trying to get. So step 3 would be identify their pain points and decision-making triggers. And this is where the Facebook groups come in pretty handy. You can see the insights, you can see what people are saying, but do they struggle with dental anxiety, busy schedules, cost concerns? Are they parents seeking pediatric care? Are they young professionals considering Invisalign? Look into this, okay? So you want to do 3 things on step number 2, which is number 1, analyze your current patient base. Who are your most loyal and high-value patients, age group, income level, common concerns. Step 2, research local demographics, U.S. Census data, local Facebook groups, right? 3, identify their pain points and decision-making triggers. Remember, we discussed what the 4 decision-making triggers are. So identify them, identify their pain points. What are they? And then we niche down. An example of this is right here. And if you're listening to this on the podcast, great, wonderful. But when you can, look at the video version of it, because this is where I'm showing you right now the examples of the patient persona. So let's just say persona number 1, the busy parent, which is ideal for pediatric and family dentistry. Their ages is 30 to 45. Their lifestyle is full-time working parent, and their kids are aged from 4 to 12. Pain points would be lack of time and concerned about their children's health, their dental health. So your marketing approach is this. You want to offer convenient evening or weekend appointments, partner with local daycares and schools for easy referrals, and provide family discounts if you would like, or bundled appointments. Okay, that would be how that would look if you're dealing with the busy parent. Persona number 2, the aesthetic-driven young professional. They would be ideal for cosmetic or ortho services. This is a young professional. They're between the ages of 25 to 40. Their lifestyle, they're career-oriented, active on social media, and willing to invest in appearance. Their pain points is they want straight white teeth, but they fear high costs. So your marketing approach would be you offer interest-free financing and smile makeovers. Just offer the interest-free, right? Financing, offer something bundled up that's beautiful. A lot of the times we like to show them the big ticket price and say, hey, this is all the discounts we're giving you. You don't need to do all that. You can just say, you're going to get this at the monthly rate. That's it. You're being efficient with your time, short, sweet, to the point, brevity, and at the same time, it's appreciated by them. They're like, oh man, I can do that. That's as much as like a gym membership or a CrossFit membership. You want to partner with gyms, salons, or coffee shops where they frequent. And you want to provide a before and after transformation and influencer collaborations. And in the course, we discussed on how you can do that in influencer collaborations. And in the podcast, we discussed that. And if you want to type in the search bar on our website, thedentalmarketer.org, you can type in Tyler Brady. He discusses quite a bit on how to do influencer marketing and collaborations. But that's what you want to do. You want to provide before and after transformations big time. One thing I recommend is you want to create 2 to 3 personas and align your outreach strategies accordingly. So your ideal patient doesn't mean it has to be one specific persona and one specific ideal patient, and that's it. You can have multiple. And I challenge you to have 3 ideal patients. So one could be the busy parent, the other one can be the aesthetic-driven young professional, and then the other one can be like the retired senior who is living it up in the community center, right? And you can go from there. So that's going to be step number 2. So to recap, step number 1 is the science behind patient behavior and decision-making. 2 is defining your ideal patient persona, which we just did. 3 is now locating and approaching your ideal patients. If you want all the strategies, everything that revolves around ground marketing, you want to learn how to get into apartments, corporations, senior homes, daycare, schools, restaurants, hotels, spas, gyms, every single location you can think of, and we continue to add into it, by the way, this course, then definitely join the ground marketing course. I'm going to put a link to it in the show notes below. You can go ahead and check it out, see everything that you can learn, gain, and at the same time, how it can improve your practice and your life. Not only will you attract new patients immediately, but also you'll be known as the go-to practice in your community. But if you want to learn all that, go in the show notes below, click on the first link in the show notes below. It's the ground marketing course. Go ahead and join it, and I look forward to seeing you in there. Once you've identified your ideal audience, the next step is finding where they gather and crafting their perfect approach. You want to craft your perfect approach. So where to find different patient groups in your community. Now, you can make a list and put top left, patient type, in the middle, where to find them, and then on the right, best approach. If you want, you can look at my screen, and I have that right here. So if the patient type is parent with young kids, you can find them in schools, daycares, pediatrician offices, kids sports events, ice cream shops, specific gyms just for children like Gymboree and things like that, etc. And your best approach could be you can offer a free comprehensive exam, you can offer something as like a free consultation, you can have sign up sheets for parents, you can offer, hey, come in your first visit, a tour for free, right? You can create an event just for the parents to tour everything, do something amazing for the children. That would be your best approach. Patient type, young professionals. Where to find them? Gyms, co-working spaces, networking events, coffee shops. You want to go to specific events. If you're looking at the Chamber of Commerce on the calendar, you can see specific events that people are a part of. Your community throws specific things for them. A lot of apartment complexes, humongous apartment complexes, throw events every single month for people, like a wine and cheese type of thing or anything like that. You can be a part of that. And honestly, your best approach is promoting teeth whitening. That has been incredible. Promoting teeth whitening, or if you want, Invisalign specials as well. Patient type, seniors and retirees. You want to go to community centers, senior health centers, things like that. And you want to offer specific things, right? Mainly what we've seen is they have a lot of questions specifically about not just insurance, but what's covered, what's not. They will have insurance questions. And so we will dive much deeper, maybe multiple episodes on seniors. It's an incredible patient base. We forget sometimes that they're the ones who are learning the quickest the internet, and they're using it the most. And at the same time, they're excited to receive emails and so much more. So if you're at senior events, senior centers and things like that, independent living facilities, all you really have to do at those when you're speaking to them, if you're doing like a booth and a lunch and learn or anything like that, is just answer questions. And they will sign up and they will be a part of it and they will get their families to go too. So you can do free oral health workshops at these facilities. You can do implant consultations and things like that. But I'd go with just wanting to answer questions, and then you can understand the feel of the group and be like, okay, this is what they want. We're going to offer that. Or maybe they don't want anything. They just need work done and they want someone to finally answer their questions. So anyways, we're going to dive deeper on seniors in a later episode. Emergency patients, right? You want to go to urgent cares, clinics, pain management centers. That's where you can find them, and then provide specific emergency things, right? You want to partner with pharmacists, let them know, talk to them, partner with urgent cares, partner with hospitals, small clinics, things like that. But give them specific flyers if you want on the services and how you're available, what you can do, things like that. And then patient type corporate employees. You want to do HR departments, lunch and learn sessions, offices, offer insurance maximization workshops. You want to dumb it down to them literally to where you can explain it to a third grader. That's how you want to look at it. And then you want them to be able to explain it to an actual third grader. That way, you know that they understand. The more you can educate them like that, the better, especially with corporate employees, because they have a ton of work. They're doing a lot and they just want, hey, did I maximize it? Did I do everything I could? At the same time, I know a lot of members in the course, they do have on-site dental screenings, or they actually will go to these corporations and work on them. They have these mobile units that they can just go and do cleanings there. That is huge and helps them out a lot. And the companies absolutely love that, because more time there is better for the corporation than, less time out and about scheduling and then having to be out, right? So if you can offer that, that's awesome. Like I said, we dive deeper into that as well in the course. Now, you want to strategically choose locations where patients already gather rather than trying to bring them to you. Okay. So if they're already there, strategically choose that location. I'll give you an example. There's a pretty big hotel. Let's just give a name, right? Let's say the Hyatt or Marriott or something like that, right? And they have quite a bit of employees. And instead of you trying to go after, oh, hey, let me go just for the front office. Hey, let me go for the maintenance technicians, housekeeping. They actually have team meetings early in the morning, monthly team meetings. And believe it or not, they will allow you to come in, set up your booth, and have speaking time at that meeting with everyone watching you. And so that's your time. And that is a good example of you're choosing a location that offers insurance, that offers good benefits to their employees and things like that. And you're choosing locations where patients are already gathered rather than you're trying to bring them to you individually and just handing out your flyers. You're being strategic, right? And then one of the last points is number 4, creating a targeted ground marketing approach plan. So now that you know who you're targeting and where to find them, let's just say it's the mother, right, with the kids, or it's the young professional. Now you know where to find them. You need a systematized approach. So there is a pre-visit strategy. You want to establish credibility first, right? You can either do that by connecting on LinkedIn or local business networks before showing up. That's why sometimes I do recommend joining the Chamber of Commerce or the Rotary Club, but it's not necessary. In the course, we teach you how to be a part of the Chamber of Commerce and all their events without actually joining the Chamber of Commerce. So you don't have to pay that fee. It does help if you are, because you're able to be a part of specific networking events. Now, that's one thing you can do. You can also send an email or letter of introduction of your practice before visiting businesses. This works sometimes. I have yet to do this, but I added this in here in this episode because I know some of the members do it for specific corporations, and it's helped out tremendously. So go ahead and do that if you would like. I know with specific corporations, we actually in the course, we give you the template, we give you the whole script on what to say in the email, and then boom, you can just put your name and send it. But like I said, you can do that, or you can find a common contact who can introduce you, right? Mutual connections. That is the best thing. That is what I normally do. Find a common contact, mutual connections, and that equals trust, right? You call the location. Hey, one of your patients just came into our practice and, I had a couple questions. And they are like, because you're calling the HR department, is everything okay? What happened with that person? Oh, no, they're just saying how much they love it there. They love you. And we love them as a patient as well. And I was just wondering, is there any way we can kind of offer more specific benefits and special offers for the employees there? I mean, we love you guys. We love the employees that you have. And boom, you're able to get in there, right? And offer more. But that is because you have a common contact who can introduce you. Technically, the person didn't even introduce you. You just have a common contact. And that's what I utilize. I'm just like, hey, you work at this location? Perfect. Is it okay if I call the HR department or, you know what I mean, and let them know? And 9 times out of 10, the patient who's already an existing patient will tell you, sure, you can go ahead. I mean, I have nothing to do with it. And then just go ahead and call. And then you're able to get in. So perfect. That's a pre-visit strategy, right? And then the perfect first interaction, you want to approach without being salesy. So that's A. A is the pre-visit strategy. B is the perfect first interaction. You want to keep it casual and conversational, not sales pitchy. I can't express to you how important this is. Keeping it casual, almost like you're talking to a friend. Not overly casual, but casual in the sense of you're not walking in there with everything in your hand and you're not on the phone call like you're reading something from a script, although you might be reading something from a script. You just want to keep it casual. Offer something of value up front and then use social proof. We worked with other businesses and we've helped their employees and patients. We would love to support your team too. You can use social proof in the sense of, every month we partner with a fitness facility. And this month we would love to partner with you guys. We saw incredible results for our patients, the employees or the clients or the members in 24-hour fitness. And we really wanted to partner up with LA Fitness now because that's just been a request. And do you have something every month that we can be a part of? Boom. They're going to say, yeah, we do. We have something that you can be a part of. Wonderful. How does this work? And then you can continue with that. Never start with, and this is a humongous pro tip, and you hear this all the time, and you've probably done this. I've done this. So never start with, hey, we'd love it if you send referrals our way. So you're going in, dropping off flyers to the perfect location that you want your ideal patients to come from. And you're like, hi, I'm the new dentist down the street. We'd love it if you send referrals our way. That does nothing. Maybe 1 in a million times it might get you a referral here and there, but that's it. They just know as you're the person who's asking for something. So start by offering something first and then C, follow-up system. I cannot tell you how important following up is. And I discussed this in the previous episode. I mentioned this is probably where you either gain or lose the most potential patients, new potential patients. Most people won't book immediately. They need reminders and touch points. So you want to immediately follow up, same day, send a personalized message thanking them for their time. Everybody you meet at an event, you just dropped off something, you introduced yourself in the sense of you're going to go be a part of their event, you dropped off a sign-up sheet. Just follow up immediately that same day. More than likely, the person you spoke with is not one of your patients already, and they can become your patient. Step 2, you want to do a 3-day follow-up, right? Provide a quick reminder about the offer, the benefits, and then you also want to follow up again with that. If they haven't booked, you want to offer a limited incentive. This month, our free whitening is ending, and I noticed there's only 5 more days left, or we have 5 free whitening sessions left. We'd love to save 1 for you, things like that, right? And we're going to dive so much deeper, multiple episodes on how to follow up specifically. But in the ground marketing course, I give you the breakdown, I give you the scripts, I give you templates, everything on exactly how to follow up, how many days you should wait, how many months, if so, and what to do and what to say in each of them. But remember, 80% of conversions happen after 5 to 7 touch points. So keep nurturing leads. Always keep nurturing leads. So final thoughts, you want to have a targeted strategic ground marketing plan. That is the key to success. So, a step by step summary for success, and in this episode, is number one, you want to understand patient behavior, identify what drives decision making, and we discussed that, right? Convenience, cost, trust. Create clear patient personas, define who you want to attract, and then define their pain points. Get those two crystal clear. Three, locate the right places. Be where your target audience naturally gathers, but be there consistently. Don't just be there one time and that's it. Be there as much as you can for as long as you can. Locate the right places. Four, use a systematic approach. Have a pre-visit strategy, an engaging first interaction, and a structured follow-up. So when ground marketing is done strategically, it builds sustainable, high-value patient pipelines without relying on expensive ads. Identifying your audience is the most critical step to making your efforts pay off. So that's what you want to do first and foremost, okay? So thank you so much for tuning into this episode. I hope it helps. I'm excited to see you continue to skyrocket on your ground marketing journey. If you have any questions or concerns, please feel free to reach out. You can email me. You can find me at michael@thedentalmarketer.site. That's the email. Or you can just go on the website, thedentalmarketer.org, and fill out one of those follow-up forms. But the best way to reach out to me is if you are part of the ground marketing course, which I'm going to put a link to it in the show notes below. It's going to be the first link in the show notes below. I mean, we have live office hours like this. You're able to engage with me, talk with me. It's like a mastermind session. At the same time, in there, you're able to see all the strategies, all the scripts, all the templates, all the workshops. You even see real life examples of me. I hide the camera or I'm on the phone doing these strategies, and you're able to see it work in real time, exactly how it's supposed to be. So definitely join the ground marketing course. I'd love to see you in there. I'd love for you to be a part of it so you can start attracting new patients, but at the same time, become the go-to practice in your community and build these incredible local partnerships. And that's what we're going to be discussing in the next episode, building local partnerships that matter. So thank you so much, and I'll talk to you soon.